what is kind of your secret to success, and how you've been treating especially ED and items along those lines?
First of all, I think there's a real need for men's focused healthcare. Right. I mean, I think, for instance, Western practice, we have a lot of things that have to do with men that we are concerned about. For instance, prostate health or heart disease or, depression, anxiety, these various things. But I think there's definitely space to have a discussion about the aging process as it pertains to men specifically and our sexual health. And there was a need for the medical community to step in and provide this type of attention. And I saw that. My background is actually emergency medicine. So my original training, my profession is saving lives. Yeah. And that's what I'm board certified and trained to do. I went to a medical school initially to do, and I still practice emergency medicine. But I'm very passionate about the other side, preventing men from getting to the point where they arrive in my emergency department. And it all ties to sexual health. It all comes together in terms of the wellness and quality of life of men.
Okay, so you've had really great success, especially in these last few years. Things have really been doing well. So what are some of the treatments and what really sets Innovative Men's Health apart? Why are you so successful in this particular area, and what are some of the ways that you handle these issues?
I think the key to our success is, number one, being knowledgeable.
Right.
So we are on the cutting edge of finding therapies that fit your unique scenario. So the first thing we're going to do when you show up to our clinic is we're going to sit down and really get a good history and try to understand your background, how you got to where you are now.
So it's not kind of an all, one treatment fits everybody. There's a unique approach to each individual.
Absolutely, and I think that's the key to our success rate that we have. We have 3 pillars at Innovative Men's Health. Okay, number 1 is optimization. Number 2 is balance, and we talk about the balance between the hormones. For instance, if we're going to address hormones, we do it in a way that takes into account, for instance, that testosterone is not working on its own, and it involves the management of progesterone, estrogen, and really making sure everything's functioning together. So there's a holistic approach to our treatment just within the hormone scenario itself. And then the last pillar is safety. And I think those 3 pillars are the reasons why a lot of patients go from the primary care setting, which is important, but they go from the primary care setting to visiting our services, because we offer a much different approach to the issue of sexual health and anti-aging in general.
So one of the things that you talked about, I really liked how you addressed that this is actually, it's not a one-size-fits-all, and that it's a unique approach, and how you sit down and you consult with each person on individual program. I think that's really great. And you also mentioned like the pillars that you focus on, and could you talk to me a little bit more about what those are and how those affect your approach?
There's no one size fits all. We're all very different in terms of how we got to the level of dysfunction, if you will, in our sexual life or in our lives in general, being off balance. At some point, the aging process for each of us occurs in a different fashion. Everybody has their own history to the aging process and the symptoms of aging, which I consider sexual health to be in that paradigm. When you go back to our pillars in our approach, for instance, our first one, optimization.
Right.
In Western practice, there's this common understanding that there's a cutoff. There's a disease cutoff. For instance, for testosterone's sake, just for the sake of discussion, you may have levels that go from 200 to 1,000, let's just say. If you're below 200, then you're diseased, you have a problem, it needs to be treated, it needs to be addressed. If you're 201, you're fine. You just need to lift yourself up by your bootstraps, and this is not your issue. Testosterone can't be your problem. We take a much different approach. If all the signs and symptoms point to a testosterone deficiency or even a testosterone imbalance or sub-optimization, we're very concerned about that. You know, we understand, for instance, that a person who has a level of 300 and you can improve their levels to say 700, they're going to have a significant change in their life, especially if you can balance the other hormones around it, keep the patient safe. Then they're going to be very thankful for your intervention in that regard.
What are some of the other pillars that, besides just optimization, what are some of the other things that you focus on?
We talk a lot about safety, and I think that's something that our patients have come to appreciate about us, is that we take a very individualistic approach to safety as well. We do have a set curriculum for our patients given their scenario, in which they will have, for instance, a certain set of labs, a certain set of follow-ups, and they'll be expected to have some basic set procedures.
Some involvement on their behalf, yeah.
Yes, but what they also appreciate is an open door policy, quick callbacks, the ability to call their doctor, the ability to get online and have somebody they can reach out to by email and get a quick response.